Good morning. My name is Angela Dawkins. I'm from the Community Outreach Program, and we're here today for the Bowie Health Fair. I have with me Joan McHale, for the director of the Bowie Health Center. And Ms. McHale, I'd like to ask you a couple of questions.
Okay.
Could you introduce yourself and tell us what you do?
I'm Joan McHale, and I'm the Director of Operations for Bowie Health Center and Dimension Surgery Center in Bowie, Maryland.
And what kind of services does the health center provide?
The Bowie Health Center is a freestanding medical emergency facility which provides emergency and urgent care, mostly emergency services to 37,000 people a year, where the surgery center is elective outpatient surgery, and we do approximately 4,300 cases a year.
Thank you. Today we're having a health fair. Could you tell us a little bit about what the health fair is?
The health fair is an opportunity for people of Bowie to come and get free information and screening for preventative health and wellness in the community. In the ER lately, we have seen a lot of people who for one reason or another have no access to primary care or limited access, and so they access the emergency room for their primary medical care. We're hoping this is a way to help them get their care in a different way.
And what kind of exhibitors are here today? Could you give us a little bit about what kinds of exhibitions are going to be here today?
We have several physicians who are donating their time to do the free screening. We're doing cholesterol and glucose testing. We have a range of exhibitors of products and services who are healthcare related, who are also exhibiting in the tent and the tent over there behind us.
Earlier I saw a very long line for flu shots. Are flu shots being given today? And how many do you know?
We have flu shots. We only have 80 doses, so we don't expect they're going to last long. There is a huge amount of interest in that, as you can see.
Hi, I'm here now with Diane Karkosh from the Bowie Crofton Pregnancy Clinic. Diane, would you like to tell us a few things about your services you provide?
Absolutely. Thank you for interviewing me. We have been in the community. Bowie Crofton Pregnancy Clinic's been in Bowie for over 27 years, providing free pregnancy tests and counseling on all three options. We have added 3D, 4D viability ultrasounds. We have added STD testing and other screenings, and we do all of our services free of charge. Most of our services are provided by volunteers, and we are here as a service to young women, their boyfriends, and families in providing all the information needed at a very pivotal point, a life-altering point in their lives.
Can you tell us a little bit about the related health concerns with pregnancy and STDs?
Sure. Related to casual sexual activity, we are in an epidemic nationally. 65 million people are carrying a disease which is incurable. Each day, another 19 million, that's 52,000 a day of our young people and older are contracting an STD or sexually transmitted infection. So we are concerned about lifestyle issues. Unrelated to STDs, of course, is pregnancy, and that is something that we're seeing 1 million abortions a year. But in addition to that, we have 400 to 500,000 infants being born to young women under the age of 20. So even with all the information, we still need to do a better job as parents and schools teaching on the risks, both, all of the areas, mind, body, and spirit.
Are there any symptoms that people should be aware of that they should go immediately to their doctor or to your clinic?
Oh, well, absolutely. We have a website which is invaluable, and we find most of our clients come or call us because they saw our website. It's pregnancyclinic.org. We go through all the symptoms of pregnancy, all the symptoms of STDs, but the bad news is that you can be a carrier of an STD and not have any symptoms. So we highly encourage testing, but if someone poses an acute pain and has had a pregnancy test that's positive, we of course encourage them to go directly to the emergency room. And we want to get them started, if they don't have insurance, on some of the state-funded and county-funded programs that are available to them. So we provide a lot of referrals, legal, medical, and housing, as well as the verification of pregnancy, which they need to get on the MCHIP program.
Is there anything else you'd like to tell us before we close?
Well, an interesting point is that we have men and women in the community who are drawn to our organization because they want to serve and support our young people. And so many of them, you know, we've all been a teenager once ourselves, and we know some of those issues affecting their lives. And yet, in taking our intensive 10-week training, many people find that they're actually there to do some healing and recovery from some of their own issues. So it is an invaluable service that we provide. Many of them go on to do internships and to become our volunteer lay counselors and medical staff.
Hi, Angela Dawkins again. I'm here with Larry Blosser of Life Care Advisors. Mr. Blosser, could you tell us a little bit about your organization and what you do?
Yes, we're a life care planning law firm, which is a little bit different approach to elder law, because we provide a range of services that relate to anything regarding health care. Could be a disabled child, it could be an older adult who's struggling with Alzheimer's or dementia. We help the family help relieve caregivers' stress by doing everything from preparation of the legal documents to placement in a facility that's appropriate to their needs.
And who's your typical client?
A typical client is usually the oldest daughter in the family or the spouse, someone who's experiencing some caregiver stress, dealing with finding the right placement, finding the right resources in the community, or just struggling to find the way to pay for resources that are available.
Okay. Do you work with Social Security Administration or hospitals? Or how does someone get to you? How would somebody know that you are out there?
Okay. We work with geriatric care managers, the folks who are doing the social workers that are doing outplacement. We can provide assistance with Social Security, VA, or other disability benefits. So anything from advice on when to enroll in Medicare, how to qualify for Medicaid, we do all of those things.
And is your fees generally paid by the family, or is there some health or maybe government would pay for this? How is that usually handled?
These are usually private pay services. There are some cases like Veterans Appeals where we would have a basis for getting a percentage of the recovery that we get for arranging for the veterans' benefits.
Do you also do things like estate planning, or is that out of your range?
It's part of what we do. Typically, our clients are middle income, and there is some estate planning work that necessarily goes into it. One of the things that's important is to avoid making mistakes in estate planning that will disqualify someone for a benefit down the road.
Hi, I'm here with Jacqueline Williams of Capital Hospice. Jacqueline, what services does Capital Hospice provide?
Capital Hospice, well, thank you. First of all, thank you very much for this opportunity. Capital Hospice provides care for individuals and their families who are facing advanced illness. We provide expert, compassionate, physical care, spiritual, and emotional support for patients and their families in Prince George's County, D.C., and Northern Virginia.
Please tell us about a little related health concerns.
Okay. People often wonder, well, who is eligible for hospice? When might we call hospice? And what we like to tell people is that we're talking about individuals who are living with serious progressive illness. It could be AIDS, Alzheimer's, lung disease, heart disease, kidney disease, various kinds of cancers. Any of those individuals who are declining. And how you might know that is if an individual maybe is losing the ability to take care of themselves, maybe depending on oxygen when they weren't in the past, having trouble getting around, losing a lot of weight, maybe unintentionally, back and forth to the emergency room or the doctor's office. Basically, their life is starting to revolve around their illness.